My husband died of COVID in April 2020. Our daughter was 10 years old at the time. We weren't allowed to go and visit. I was offered the opportunity to go in the day he died to say goodbye, but because they didn't have enough PPE, my daughter and I couldn't go in together. So we said goodbye to him via Skype.
The COVID-19 pandemic was not only a global medical emergency, it also had an extraordinary impact on people's experiences of bereavement. More people were bereaved in more distressing circumstances, and social distancing meant people couldn't be visited or comforted by family and friends, limiting how we could console and support one another. I'm Emily Harrop, and with Lucy Selman, I led the ESRC-funded Bereavement During COVID-19 study. Our research shaped the UK's policies and services around bereavement. It also supported greater societal, political and policy-level understanding of how bereavement affects different people, and the importance of ensuring equal access to appropriate support.
Working alongside a team of researchers at Cardiff and Bristol universities, our research investigated people's experiences of end-of-life care and grief, the support bereaved people needed, and whether they were able to access it.
ESRC funded the original study from August 2020 to February 2022 as part of the UKRI COVID-19 Rapid Response funding stream. This support enabled us to fund our team of researchers to design and undertake this national study.
Our study demonstrated the extraordinary challenges of being bereaved during the pandemic, including disruption to end-of-life care, mourning practices, social support network and people's coping mechanisms.
It's had a huge influence both on practice and on policy. We were very fortunate that Emily and Lucy were open to coming and sharing early findings back to the sector at some of the webinars that we run for managers and practitioners. We used the findings to contribute to our responses to comprehensive spending review, in submissions to the Health Select Committee and continued submissions to officials across government. That's been extremely useful to us in having those up-to-date findings, so we know that people can trust what we're saying, that really has come from the experiences of bereaved people.
As members of the UK Commission on Bereavement Steering Group, we helped conduct the public and professional consultation represented by its report, Bereavement is Everyone's Business, which sets out the wide-reaching changes needed to improve support across the UK, and we continue to work on its recommendations. The UK Commission on Bereavement was spearheaded by Sam Boyston at Marie Curie to take forward and develop this work further.
It was clear from the work that the pandemic was making a really profound impact, a really profound and negative impact on people's experiences of bereavement. However, I think as well as that, it was exposing problems around bereavement support that had existed for years and years and years, and that we had never properly as a society dealt with. And this provided an opportunity to really grapple with those problems, to take them on and to say, actually, we do need to improve bereavement support in the future.
Patrick Vernon, who himself was bereaved during the pandemic, was one of the 15 commissioners from different backgrounds across the 4 UK nations.
As we were deliberating as a commission, we were getting updates from the research work, from the field research, and also the kind of the mapping exercise around policy and the gaps in policy, and that's actually influenced some of the principles, and it's also influenced some of the recommendations.
Since launching the study in 2020, our research has contributed to improving societal and government understanding of the importance of person-centred bereavement support that is available and accessible to all who need it.
It's making it real. It's not just a case of these are all stats and numbers. Behind every single person is an experience, and I think that research like this can really highlight the impact that was had on losing people during the pandemic.